The study we're discussing now, which is abstract 53, is a add-on to results that have been presented previously at ASH, evaluating Imetelstat, the telomerase inhibitor in patients with advanced myelofibrosis who are relapsed and refractory to prior JAK inhibitor therapy. So the analysis that is presented at ASH this year is looking at associations between clinical benefits, for example, spleen reduction or symptom improvement, bone marrow fibrosis reduction, which was seen with Imetelstat, and correlating it and associating it with survival benefits. So the first thing to be aware of is in the randomized phase 2 study across multiple sites with Imetelstat, which is delivered in intravenous formulation every 3 weeks. There were 2 dose levels, 9.4 milligrams per kilogram IV, and then 4.7 milligrams per kilogram IV every 3 weeks. The survival in the high dose arm was approximately 29 months, and the survival in the low dose arm was approximately 19 months. And this is quite favorable when you look back at multiple studies now that would report a survival of 12 to 15 months in patients who failed and discontinued ruxolitinib. So it would appear that there is an effect on the disease that translates to improved overall outcomes, which is a little bit different perhaps than many of the therapies that are under clinical investigation right now that are focused on spleen and symptom benefit only. So the spleen and symptom benefit was seen with this drug. About 10% of patients had a SVR 35%, and about 30% of patients attained a TSS 50%. So there were those classic responses that were seen. What this abstract shows is that you could correlate those responses also with survival, that the patients who enjoyed spleen response, who enjoyed symptom